The Ontario government is at it again. They are planning more cuts to pharmacy funding. Every pharmacist in Ontario needs to know about this and to do something about it. On July the 10th, the Deputy Minister of Health made a presentation about Ontario's drug system. It was titled, "A Case for Change." In his presentation, the Deputy Minister made it very clear that the government is targeting the business of pharmacy. Until a balanced funding formula is agreed upon by both sides, the profession of pharmacy cannot exist without the business of pharmacy. Targeting one necessarily targets the other. The government doesn't think Ontario is getting enough value for money from pharmacist care. Well, my patients value everything that I do for them every day.
I know that we do value this particular pharmacist in general. He's always very helpful.
We've got 2 young children, and we feel that if we needed something right away, then at least we know we could go to our local pharmacist. He would be there, he'd be supportive, and we know we can count on him.
I get valuable information from my pharmacist.
As my pharmacist, I have a personal relationship. I know him by name, and I've been dealing with him since I've retired.
My pharmacist, Joe, at Hooper's, he's the neighborhood hero. Everybody goes to him for everything.
Here are some things the government said about pharmacy. They say the professional allowance system that they created is not working to their satisfaction. So we can expect them to try and cut allowances again or eliminate them altogether. They say we have too many pharmacies per capita in Ontario. Logically, that means they'd love to see some of them go out of business. They say Ontario pharmacies don't provide enough services to patients. They want us to do even more, apparently with even less funding. The government's priority is cutting their budgets, trying to reduce their deficit on the backs of pharmacies and at the expense of patient care.
When it comes to healthcare, I'm going to trust my pharmacist a lot more than I'm going to trust some bureaucrat. I just don't understand, why can't they leave it to the experts to run it?
I think the pharmacist would be much better to make those decisions than the government, because they know what you're dealing with. They're there on a day-to-day basis.
I'd listen to a healthcare provider before a politician, for sure.
I don't know anyone in the government that knows medications. Do you?
It's time for pharmacists to stand up and say no more. No more cuts to our funding and no more bureaucratic meddling in how we provide patient care and how we run our practices. Now is the time to negotiate a long-term solution for ODB. Pharmacy care is one part of the healthcare system that actually works. Patients get timely, accessible, quality health care, and payers get great value. And it's getting better every day. Let's keep it that way. Reach out and contact your Ontario MPP and tell them, don't cut pharmacy funding again. Let's work together on building a funding solution for the future.